Hi, my name is Kara Covey. Tonight we're going to talk about Zepatier, which is a direct-acting antiviral agent that is used for the treatment of hepatitis C. Hepatitis C is caused by a virus that affects the liver. Once it enters the liver, it has the ability to reciprocate itself, but as opposed to other viruses, it creates mutant variations within the liver, which causes an inflammatory response which decreases the hepatic function, results in swelling, and it can result in a chronic inflammatory response in the liver, which can lead to liver cancer, cirrhosis of the liver failure, and can ultimately lead to these patients requiring a liver transplant. In 20 to 50% of these patients, it is just an acute virus and it has no other effects other than it is a chronic illness that is with them always, and they have the potential to spread this disease to other people. In most patients, it affects the homeless, severely mentally ill, prisoners, and IV drug users, as it's transmitted by exposure to body fluids or blood. The first direct acting antiviral agents were introduced in 2014, which was offered the first cure for patients who had the hepatitis C virus. Prior to that, the treatments were long, ineffective, and had multiple side effects. Zepatier is a direct-acting antiviral agent that is an oral medication. It is taken once a day. Approximately 3 million people in the United States have hepatitis C, and approximately 130 to 150 million people worldwide have hepatitis C. It is a chronic progressive disease that can lead to liver failure, liver cancer, liver cirrhosis of the liver, and the increased need for a liver transplant. Zepatier is an oral direct-acting antiviral agent which is taken once a day for 12 to 16 weeks depending on the stage of the disease. It is an NS5A and a protease inhibitor, which basically stops the progression of the hepatitis C at a cellular level. It has actually been ranked as one of the most cost-effective DAA agents available to the general public. If you're comparing Zepatier to Harvoni, which is also another combination drug therapy for the treatment of hepatitis C, they are both direct-acting antiviral agents. The Zepatier is an NS5A inhibitor and a protease inhibitor. The Harvoni is an NS5A inhibitor and an NS5B RNA inhibitor, which actually prevents the drug from being able to reciprocate itself within the human. They both have drug interactions with dilantin, tegretol, rifaximin, St. John's wort. With Zepatier is also contraindicated to patients who are being treated for HIV or patients who are taking cyclosporins for immunosuppressant disorders. Also, Harvoni you cannot take with Crestor or digoxin. They both have about the same cure rate, which is about 95% depending on the stage of the disease once the medication is started. Both medications are generally well tolerated, with the most common side effects being headache, fatigue, elevated liver enzymes for the patient taking Zepatier, but not to the point that you want to stop the medication. Harvoni also has side effects as associated with insomnia, diarrhea, and nausea. The main difference between Harvoni and Zepatier is the cost. The Zepatier average cost is about $56,732 for a 12-week course, or GoodRx offers a coupon in which you can get the drug for about $22,821. or the Harvoni, which is the most expensive at $113, $411.39. GoodRx does offer a coupon for about $90, which makes the drug available for $98,115. Both of the manufacturers for Zepatier and Harvoni offer reduction costs for patients who do not have insurance, who do not qualify for Medicare or Medicaid, in which the drug is available at about 25% off the market price. The expected outcome is to be cured of hepatitis C virus. So it is expected after 24 weeks after treatment that both will be cured of hepatitis C. Both drugs are effective. Both drugs are very well tolerated, but the Zepatier is much lower in cost. It's about a fourth of the cost of the Harvoni. So for the same benefits, but like I said, about fourth the cost. Thank you very much for your time, and I hope you've benefited something from the brief video that I've made. Thank you and have a great day.